Good morning, and thank you all for coming. My name is Sarah Byrne-Martelli, and I'm a chaplain at Mass General in Boston, and I'm also a member of the executive board of OCamper. So today I just want to introduce our speakers. So the title of their talk is Suffer the Little Children, Fostering Communion and Finding Hope in a Pediatric Critical Care Setting. So we have Stephanie Storgen, who is a pediatric intensive care physician, Leah Apollodemus, who is a pediatric nurse practitioner in cardiology, and Elizabeth Hawkins, who is a board-certified chaplain, and they are all members of the Annunciation Greek Orthodox Church in Memphis, Tennessee. Thank you so much for being here.
Thank you, and thanks everyone for joining us. My name is Elizabeth. We are going to be doing our kind of longer introductions in a minute, but just to introduce the talk, when I was sitting at OCamper last year and they announced the theme for this year, immediately my mind went to how applicable this is for my work setting. Again, I work in pediatrics. I work at Le Bonheur Children's Hospital in Memphis, Tennessee. At the time, I worked primarily in palliative care. Now I've switched roles a little bit there. But like any good sermon where you're sitting there and you're thinking, this all applies to me. It was such a good conference topic because I think of these issues of violence, isolation, hope, and communion. And in my mind, there is no better workshop or venue to explore these issues than in a pediatric critical care unit. But again, it's because that's where I spend most of my days. So I think probably the day of, I texted my two good friends and colleagues and said, we have to present a workshop to explore these themes. And also, selfishly, I've been coming to OCamper on and off for about 10 years, and I don't see a lot representing pediatrics. And usually when I introduce myself as working in pediatric palliative care, I get a lot of sad faces. And my response is always, this is so great. We have so much fun at work. And even among Orthodox colleagues, I would get a lot of, oh, that's so sad. And I'm like, no, especially using the lens of our theology and faith to inform our practice. It makes it so meaningful. And so thankfully, I have my friends and colleagues that I sometimes work closely with, sometimes not as close, just physically not as closely with, but we have the joy to sort of debrief, to kind of find each other when times are hard, or to say, this is what I was thinking of. So this workshop is kind of what we do informally all the time. It's sort of how we process issues that we encounter at work through the lens of our faith. And even though, again, this is sort of in the backdrop of a pediatric critical care area, we're hoping that sort of our reflections, our time together will be universal enough to apply whether you work in the adult world, whether you work in medicine, or whether you come more from academic theology, or whether you're a counselor, just kind of a universal application of our faith. And of course, as a nod to our love of Trinitarian theology, unity and diversity, there are three of us representing different perspectives. So, without further ado, my colleague Stephanie.
So this slide shows where we work. On the left is Le Bonheur Children's Hospital. You can see there's a big heart at the top because it is a place that is a pediatric hospital for all children, and we have the privilege of working there. And next to it is our other home, is Annunciation Greek Orthodox Church in Memphis, Tennessee. So we wanted to see where we are. So we first want to talk about the ministry of vocation and how does our faith inform. So all of us are called something. I am called Stephanie, but my baptismal name is Styliani, and my saint is Saint Stylianos, who I saw prominently in the church this morning in the icons that ring around the dome. So Saint Stylianos is a remarkable saint because he's only one of few, in addition to the Theotokos, who was holding a baby. And having that name, I was named after my grandfather, my papu. My brother has the same name. He's in business. But I was called to medicine, and I was called to pediatrics very early. Critical care claimed me, only because, and I say that, even in my clinic as a resident, I had to intubate a patient, put a breathing tube in to assist them in breathing. I would have patients on the floor that would get critically ill, and I felt that this is where I wanted to be in critical care. I've been doing this in Memphis for 32 years, with 5 years prior to that as resident and fellow. So pretty close to 40 years I've been in pediatrics and pediatric critical care. I've probably taken care of over 30,000 children, had the privilege to be involved in their life with their family. And in pediatrics, we always have more than one. Saint Stylianos was he was in a monastery, and when you read his story, it says he shone so brightly that Christ said, "You have to leave." And his passion was for children, and people prayed to him for children. And I am so fortunate to have someone to talk to in my daily work, Saint Stylianos, when things are getting hard. And I can tell you that in our critical care in pediatrics, everybody says to us, "How can you possibly do this work? It must be so sad. It must be so hard." 2% of our patients die. That means 98% of our patients live. But sometimes we have children who suffer for the rest of their life on this earth from the consequences, either from the disease or from, was spoken earlier this morning, from the violence inflicted upon them. And so some of the hardest thing in my career right now is seeing children who I have taken care of for their entire life, who have not developed, who have not been able to grow as their parents had expected them to because of severe brain or physical injury. But I know that when they fall asleep in the Lord, that they will all be healed. And so recently, when I was doing a brain death exam on a young child who had drowned, a neurologic death exam, the family asked me, "How can you do this work?" And without thinking, and this is the first time I think I said this to a family, because it is a gift from God.
To begin, we sort of had the question of, do you feel called to ministry? And I wanted to speak, and obviously Stephanie and I have gone over this before. I don't feel called to chaplaincy at all. As I might have mentioned earlier, I am a graduate of Holy Cross Greek Orthodox School of Theology. I have a master's in divinity. I always say my thing is I feel pushed more than called. I think if you had asked me at any point before I started working as a pediatric chaplain that I would be, I think I studied film. I was going to be a filmmaker. I studied film. I grew up in the Greek Orthodox Church. My family's Greek. I did Goya. I did, the Greek dance. I did the church camps. I've always loved involvement in the church, but growing up, I didn't see women study theology. I didn't see, we have the Sunday school teachers, the women in choir, Philoptikos, but I didn't see women working. So I never thought of this as a profession. I never envisioned myself working professionally in any sort of ministry that I would need a theological training for. And so when I had my quarter life crisis and decided I want to go to Holy Cross, and it took a lot of courage for me to tell my parents this after I was a film major and I decided the end of my senior year to apply to go to Holy Cross. My mom said, we were waiting for you to tell us this. And I thought I was struggling, like, oh my gosh, my life has been on a certain trajectory these last few years. I've invested so much in this education. And then if you had told me at any point in my training I would end up working in a hospital, I would have said you're crazy. If you would have said you're going to work in pediatrics, I would have said you must go see a neurologist now. There's something wrong with your brain. And if you said I would have worked in palliative care, I would have just probably laughed or something. But all of these things, I think if you had asked me leading up to it, if this is the course my life would take, I would have complete disbelief. But I think God gives us gifts to be prepared for the work that we do, and I can look back at my life and see how I've been prepared. I was joking just yesterday. I say this a lot. I have a terrible memory, but I'm thankful to God for that because I can do my work and remember very little of what I see. I'm very forgetful. As a student, this is hard. As someone in social settings who never remembers names, this is very hard. But as someone working in a hospital, this can be quite wonderful. I feel called more to obviously being a Christian, I tell people, I was baptized as an infant. Again, my family's Greek American. I was baptized as an infant, but I choose to be Orthodox because I love my faith, and it's something I reflect on every day. For my little icon, I chose the hospitality of Abraham. I love this image of people living in community, of a precursor of our Eucharist, of giving communion, because I feel really called to work together with people. And in thinking about the theme of isolation, I've always, throughout my work, I used to work, I trained in adult hospitals. I worked in geriatrics for a little bit. I always found myself drawn to visiting the people that didn't have a lot of visitors. I thought the least I can do is come talk to you and say hello. I feel strongly in living in community and cultivating that within my work at the hospital. And I know it's a good day. It's either a bad day when I'm going to visit babies that don't have families there, or it's a really good day when I can just have some time to go read some books to some babies or hold a baby. That's the joy of pediatrics, is, getting to interact. I work closely with our child life specialists, and I say the spiritual care interactions for infants is very similar to just the regular psychosocial development. There's therapeutic play, and it's a good day when I get to spend some time with some babies.
Good morning, everybody. Thank you so much for joining us. I'm Leah Apollodemus, and I'm going to take a moment and actually read to you my quote. This is from Saint Maria of Paris, and it says, "And when we act in our modern life, visiting the sick, feeding the unemployed, teaching children, keeping company with all kinds of human grief and failure, dealing with drunkards, criminals, madmen, the dejected, the gone to seed, with all the spiritual leprosy of our life, it is not a job and not only a tribute to obedience that has its limits within our chief endeavor. It is that very endeavor itself, an inseparable part of our main task. The more we go out into the world, the more we give ourselves to the world, the less we are of the world, because what is of the world does not give itself to the world." So when discussing whether we feel called or not to our practice, whether it's, as chaplains or physicians or nurses, I never felt a calling, but I also didn't feel not called. I knew that I was going to take care of children somehow. But for me, my work is my prayer. My work is my ascesis. My work is how I hope to achieve salvation. I am not great at fasting. I am not great at prayer rules. I'm not good at a lot of things, that the church asks us to do that is all part of that work towards our salvation. But I look at this beautiful quote from Saint Maria of Paris, and I see in there a really difficult call that, some people who are really great at prayer rules, might not be able to answer in the same way that I do. But this idea of being with drunkards, criminals, madmen, the dejected, the gone to seed. So those aren't necessarily always my patient, but that's the families, that's the group that I am really, truly caring for. And the idea of continuing to give myself to these people is, and giving myself to the world, in turn, having, that be part of how I achieve my salvation. This just resonates with me. And so just a little bit about my background. I have worked for over 12 years in pediatric critical care settings. I was a bedside nurse in pediatric ICU and cardiac ICUs. And I've been a nurse practitioner now for several years, working in pediatric critical care and now in pediatric cardiology. And my practice in cardiology, I enjoy still being in the pediatric ICU and the cardiac ICU, and then as well as the neonatal ICU. I spend a lot of time there. And so with that, we'd like to just hear, we really want to have this be a conversation, like Elizabeth mentioned at the beginning of our talk. And so we'd like to just take a quick moment for you to introduce who you are and what your backgrounds are, and, and if you are just, can't even think of anything else to share, just tell us why you chose to come to this talk, if you wouldn't mind.
How much?
Just
And if you don't feel like talking, it's okay.
you could just
Okay.
Yeah.
So I am Carly Frederick. This is my third OCamper experience, and I love coming, and I'm so happy we have nurses. I am a psychiatric clinical nurse specialist, a psychiatric nurse practitioner, and a pediatric nurse practitioner, and a nurse educator. I just like going to school a lot. Currently, I do the psychiatric care in a primary care office, and I love that because I become part of the family. I've been doing that since for a long time, since 1999, and so I have adults that drag their kids in and say, "You talk to him like you talked to me when I was 9 years old," and so it's become this longevity thing. I have worked PICU, trauma resource. At CHOA, at Children's Healthcare of Atlanta, at Eggleston. So I've done that as part of my background, but I just have always been coming back to psych. I chose to come here because I love this, and I'm so happy you guys are presenting. But also, in part of what my experience was as a psych peds is the psych of the family, and I'm relatively new to orthodoxy, so that beginning to incorporate that, like you were talking, this is my prayer, this is my daily prayer, my minute by minute prayer, and how to incorporate that and how to make that part of my treatment. Sorry, I talked. I'm excited.
Can I just talk? Can you guys hear me? Oh, okay, great.
It's for Agent Faith. That's why we're using
Oh, okay. Okay.
Not so much her.
Okay, sounds great. So my name is Leah Ballinger. I am an ER nurse. I've been a nurse for about 4.5 years. And this is my first conference, and I was really excited about this. We actually had a friend of ours who's a seminarian send this to us. We were camp nurses, Cassie and I, together. And so he sent this to us and said, I think you guys would really enjoy this conference. And so we kind of just spur of the moment applied and decided to come. We were actually having a hard time deciding what talk to come to, and I chose this talk because I've been doing ER, and I'll probably keep doing ER, but I've been noticing that I'm getting drawn more to pediatrics, and a lot of people say, oh, I don't know if that's exactly what you want to do, because I'm a very, I don't know, lack of a better word, but a very emotional person. I put a lot into everything I do, and so when I chose ER, people are like, oh, do you think you'll be able to handle that? And I have been able to, without a doubt. I'm able to do my job and go home and handle it with a lot of strength, but also not dwell on the things that I've seen and stuff like that. And so I feel ready to move on to something a little bit, I think, that would add a little more emotional side to things, but I'm not worried about it. And so I kind of saw this talk, and I was like, I want to see how, like, other people are able to go in and do their jobs in a more, kids, everybody has a heart for children, and when you see hard things happen to them, you tend to get more personal into the situations, and I just wanted to hear how other people are dealing with that.
If you don't mind, sorry, just so in effort of time that we could just...
Yeah.
So we're going to go to the next section, and we're going to ask for your comments as we go along.
We'll have Q&A at the end.
Yeah.
So that we can talk. No, it's fine.
Fine. Did you want to go? Okay. So our next topic that we want to look at is communion. And in this, communion is a common union. And so in medicine, I think in all aspects of medicine, when we learn about taking care of patients, we are told, when you walk in the room, sit down and talk and listen. And I would add to that, and touch and laugh and cry. So I will tell you that in my practice, and sometimes you can't, there's nowhere to sit. And I intentionally take my cell phone out. If it's not silenced, I silence it and I leave it. So that designates that I am now here to listen to you, because listening is so, and hearing. And in critical care, in any medicine setting where it's hard information, it's difficult to talk, it's difficult to tell the bad news to someone. If you sit down and you show someone that respect, you can take that time to show them even your emotions that come with it. Not so long ago, I had the opportunity of being in a room with a family that was really in a crisis. And I took a resident and a student in with me, and I said, this is what we're going to do, and I want you to learn how to do this. And we went in and started talking to the family, talking to the mother, and we never did what we went in the room to do. And my student and the resident were like, we didn't do that. But what we learned after we walked out, what we learned was it's okay to cry in front of the family. Because we were going to, I wanted them to learn how to do a certain procedure, but the mother wasn't ready for that. And so I said, well, let's talk a little bit. And we talked, and she cried, and I had tears, and I held her hand. And then as we walked out, I said, let's pray. And in the South, let's pray is sometimes, as an Orthodox Christian, a little dicey, because how we pray and how others pray are different. But in the room was someone I had not seen in that room before. And I thought, well, maybe this is their pastor. And thanks be to God, he was. And he was standing in my direct vision, and he said the prayer while I prayed with them and prayed in my own way. And then when we left with the student and the resident, they learned something of communion. They learned how to be with someone, how to really be present. And we're not born with the gene for that. And it happens in the adult world. But in the pediatric world is where I've lived. And that's what I have found.
And when we were discussing this as a group, for me, when thinking about communion in our daily work, the first thing that came to mind was the idea of being in communion with everyone that you work with. So, yes, it is very much a prominent piece of our work, being in communion, with our patients and our families. But it made me stop and think, what does it mean to look like being in communion with those around me? Because that's also my call as an Orthodox Christian, is to love my neighbors, which include the people I work with, which sometimes can be really hard. That transcends all professions, all work areas. And, even Stephanie's example that she gave with the resident and the medical student, she was creating that communion within her work environment by bringing them with her. That was work she could have done by herself. I've been in situations in my career where family members have threatened violence, acted violent, not just threatened, had firearms in the hospital. And in those instances, being in communion with those people around me that I work with, whether it's the environmental services person or the chaplain who covers our unit, that communion is really what saves me. And so I think that when we're asked to do these different programs for team building and, like Team Steps or Send Delaney and all this stuff, most of us, I think in healthcare especially, can roll our eyes. Oh, we know how to communicate with each other. We know how to do this. Why are you making me to go sit through this thing? But I think it's important to maybe stop for a moment and think, will this help me be more in communion with the people that I work with? You know, there's some value here, so that, you know, they can know me and I can know them, and we can support each other in that way.
So we've given some examples of how we see communion in the work that we do. So we'd like to hear from all or any of you as to how are you able to integrate that into your work, and how does our faith show itself in that? Anyone?
Thank you. My name's Cassie. I think, kind of touching a little bit with what you both said, I think with who you work with is huge. I think if you're at a teaching hospital, just being mindful of your interactions with your coworkers, and maybe you have a first-year resident and you know the answer in rounds, but helping them and kind of you know, maybe when the attending steps away, like, give them your ideas and then they get the credit. But yeah, even with that, we like giving the resident the credit, or giving the patient the credit, or the family member the credit, not seeking the glory of what we're doing, but rather kind of distributing that. Can also go along with teaching family members what to do, and kind of even delegating certain tasks to them so that they feel that they're a part of the care of the individual. Thank you.
I think while I don't work in pediatrics necessarily, I'm a nurse practitioner on the inpatient side with adults. I think the two things that have served me very well across the lifespan in building communion with coworkers is, one is to focus on gratitude, however big or small it might be. If it's a small favor, or somebody went out of your way, or you noticed something, to actually verbalize that. I think as healthcare providers, we very frequently are reinforced on what we've done wrong and what benchmark we've missed. But to focus on even small pieces of things that you're thankful for within your coworkers have served me very well. And building on that, also to remove the words, "that's not my job," from our vocabulary. You know, after being a nurse for so many years, I use that. With staff for many years, but even now being a nurse practitioner, when there seems to be like a mundane task that, while it's not technically my job, never say that. And it will serve you very well, and I think goes very far from the feedback that I've been given from my coworkers that thank you for doing that. You didn't have to do that, or, you know, however small it might be. But
I'm sort of just formulating this, but I think, you know, our liturgy and our prayers, like, we don't mince words, right? In our church, like, we name, like in the funerals or memorials or all these things, like we name things like in a kind of brave way. And so I think one thing I do, certainly as a chaplain, but I think we can all do this, like, whatever we're in, is to really, like, to name what's going on and to be honest, and to kind of, if it's what's hard or what's healing or what's hopeful or what's joyful, but to really, like, give words to what is happening with our coworkers, with our patients. You know, I work at MGH, so everyone's like a little uptight there, you know, and I think, and quite academic and quite boundaried, and, you know, they think I'm some sort of like new age hippie. So, and I'm Orthodox. I mean, it's like I'm the opposite of that. But, you know, but I do think our prayer life and our liturgy and the Psalms and like the richness gives us a model for being like incredibly honest and brave. And so I think that creates communion, because it, instead of having these sort of unspoken pains and fears, it's sort of liberating.
One thing Stephanie and I were whispering about as we were handing the microphone, we said, "Oh, right, we have to describe why we chose this icon." because we love this moment of Christ from the cross saying, here is your mother, really establishing community. And I love what you said about, I find so much reassurance in our liturgical tradition, I think, and working in pediatrics. I mean, I love Panagia, I love Mary, like she's wonderful, but really working with pediatrics, I have found such an inspiration in her motherhood. And in her grief on Good Friday, the hymns to her that we sing on Good Friday, I will tell people some of the hardest things I've done is seeing mothers wail after the death of their children. But as an Orthodox Christian, I'm comfortable with that grief expression. Sometimes people want to run in. They call the chaplain because they want us to make it stop. And I'm like, unless someone's about to literally hurt themselves or others, don't knock down the IV tower, don't punch a doctor. I'm really okay. I'm like, this woman is experiencing this depth of grief that I can't understand. But I at least know that, we have this way to connect. Even in our church, even in our liturgical tradition. And again, I've connected with Panagia much more through my work with pediatrics. And also one of the quotes down here, and I loved his plenary yesterday by His Grace that talks about when he was talking about the undivided communion. And I think about that a lot. I love this prayer. And I remember, again, that's kind of the beauty of Orthodoxy is we do things over and over and over and over and over again because we need those reminders over and over and over and over and over and over again. How many hundreds of liturgies have I been to before one day reading the silent prayers of the priest? I love this. Lord Jesus Christ, our God, hear us from your holy dwelling place and from the glorious throne of your kingdom. You are enthroned on high with the Father and are also visibly present among us. And let your pure body and precious blood be given to us by your mighty hand and through us to all of your people. So I know when I'm preparing for communion, I know that I will leave liturgy. Sometimes I'm on call on Sunday, so sometimes I really will leave liturgy and go to the hospital, but at least the week moving forward, I know I'll be sent in to a room where perhaps they've just been given an awful diagnosis. I know sometimes I might go see, a relatively stable patient, but then I hear what's going on in the home, and I remember this child being hospitalized might not be the biggest crisis in their life. They might either be grieving another loss or experiencing a divorce or loss of job or income. The vast majority of, the majority of children in Memphis live in poverty, but we have a significant impoverished population. So knowing the needs of the people that I serve, I really pray that I will be able to give of myself in a way that is pleasing to God. And so when I prepare for communion and I prepare to receive Christ, I remember that I'm then in some way bringing that to those that I serve. And that's one thing that I pray about a lot.
So God made us to be together. We weren't created to be alone. And the icon of the crucifixion of Christ with Panagia and St. John next to her saying, this is your mother and this is your son, is truly what a communion. They're together. And even in his suffering, Christ made certain that his mother and the apostle that he loved had that connection. Suffer the little children. So a lot of times I would think about, why do we call our patients patients? Because they're not and we're not. The only time I really met patients that were really patient was when I had the privilege to go on an OCMC mission trip to Uganda, where the people waited outside for this pediatrician to see them of whatever age in a little tiny room. And I saw 100 people a day. And they would wait, and the day would end, and there would be more people. And I would say, we can see them. And the pharmacist and the nurse who normally ran this mother and child clinic said, no, that's enough for today. And they would applaud us. Nobody applauds us. I love basketball. I go to the basketball games. I see the Grizzlies. Somebody makes a basket and we all cheer really loud. That's their job. Anybody cheer for you in your job? We do have cheerleaders. We've got lots of them, and some of them are the angels that are over us, protecting us. But suffer the little children. So the gift of patience, and I never understood this until it finally clicked in a while in my brain. The gift of patience is the gift of long suffering. We suffer as human beings. Our patients, my patients suffer, their families suffer, and we suffer along with them. Because I truly believe that I come into work, and the people who work with me have to leave our egos somewhere by the elevator, so we pick them up when we leave, but it's got nothing to do with us. And even the healing that comes to our patients has nothing to do with us. We are the hands of Christ. We're doing that work here. We've been given the knowledge. We have the privilege to do that. And so that's where our title came from. So hope. We see sorrow and joy. We see hope. And when we see sometimes the hopeless, and sometimes we see misguided hope. We interact with people, many who are of the Christian faith, but oftentimes, mostly, not from the Orthodox vantage point. We take care of those who have other beliefs. We have many people who are Muslim, many people who are Jehovah's Witnesses. We have people who have no faith at all, Hindus, different folks from different backgrounds. And like Christ, we have to respect everyone. Sometimes the hope is misplaced. So what a wonderful gift we have on our cell phones that we can see the daily readings, and I read the saints' stories. And every day I just go, wow, that's an amazing story. So Saint Theodore of the Dardanelles was a saint who was from a Christian family, was apparently a very handsome man. He became a dealer in sesame seeds, and he was sought after by many to be a husband for their daughters. He became ill, and a Muslim man in the community said, I will cure you with our prayers from our faith, and you will be well. And he said, no, I am a Christian, and Christ, whom we Christians worship, and his mother, the Theotokos, give me my health when it is needed for my soul. And that means that when we are sick, that is also a gift, because we need it for some reason. And sometimes we see a lot in the ICU, and even more recently, we have glass walls, we have glass windows, people write on them. And rejoice in everything. Rejoice in everything. Not rejoice when you're healed, not rejoice when your day is fantastic, but rejoice in everything. But when the child gets sicker, we don't rejoice. Rejoice in everything. And sometimes we'll have to sit there and say, I'm sorry, there's nothing else in medicine that we can do. I never guess when someone's going to die because I don't know that. Even when we say we will remove support, when we say we're taking the breathing tube out, that child may continue to breathe, and that heart may continue to beat for a very long time. So recently I had a mother that could not accept that her child was going to die. And I brought up a case of another child, and I said, this is a child that my children knew. And we went they wanted to go to his funeral. I don't go to my patients' funerals. And Mama, why? This is many years ago when they were young. Mama, why? And I was praying, God, give me something. What do I say? And I said, it says that God makes us a mansion. They were so good, their mansion got built fast. And they get to live there. And they're well. So I shared that with the mother. Did that mother have another child? Was this her only child? This is my only child. I'm an only child, and this will destroy our family. My parents will be destroyed. I will be destroyed. She can't be dying. Please, God, give me something. I said, well, Christ's mother, Mary, had one child. Oh, you're right. Only one child. And I thought, in the Lamentations on Good Friday, what do we hear? Mary is pulling at her hair. She is beating her breast. She says to her son, where are you going? Are you going to a wedding? I want to come with you. What amazing psychology by the hymnologist in that. The hymn is saying her brain could not grasp that difficult thought of her son dying. So let's go to the wedding. Let's go. We had a good time. Amazing psychology by the ancient hymnographers.
So I wanted to go back for just a moment to think, practically speaking, for any of us, how do we find hope in hopeless situations? Is there something that we can do? Is there something, like you mentioned, being emotional or not being emotional, or finding hope, or, is there something practical that we can do? And so Stephanie gave some really beautiful examples of, remembering that our hands are Christ's hands. And for me, the practical way that I find hope in hopeless situations is remembering exactly that. And the way that I don't dip into just sorrow, but remain hopeful in our risen Lord, is I just will simply make the sign of the cross over my patients. And I've never even shared this with these people that I've known my whole life and that I work with. But that for me, in a still and quiet moment, when I'm with a premature infant in the neonatal intensive care unit, or if I was, if I'm in the pediatric ICU, is a good reminder to remain hopeful in in our resurrected Lord and Savior.
Yeah, well, first of all, I'll describe the icon. I'm very visually oriented. I mentioned I was a film major, so I had a lot of fun making the PowerPoint, which is wonderful because my colleagues had no desire to do so. I was like, I'll do it, please. And I was very intentional about this iconographic art. I realize this is, borrows from the Byzantine style, but I don't in any way intend that this is from worship. But I love this sort of take on the myrrh bearers. I love that they did not realize Christ had resurrected. They were doing their job. This is being recorded. The men ran away, and the women went in there to do what they had to do. And in pediatrics, it is often all women at the bedside. And I've sat with nurses as we bathe bodies. I have been with, female physicians and female respiratory therapists as we talk with families, as we serve alongside families. I think there's just sort of some blessing. A lot of us have mentioned we feel our salvation is in our work, and sometimes our work is doing the hard things that people might not want to do. I say this, I'm not a nurse, I'm not a physician. There are definitely things I can't do. I don't have the skills and the knowledge, but I know it's a team effort to do what we have to do, and there's some blessing in that. And sometimes in showing up and doing the hard work, we are surprised by the amazing things that God has prepared for us. I have seen miraculous outcomes. I have seen hope in hopeless situations, and sometimes that is just the graceful suffering that families have. Sometimes it is the woman down the hall who sees the crying that will come and bring the family a cup of coffee. It's sometimes in those small acts of service that can mean the world to people. And and now my colleagues who are much more or much better at talking about. I remind myself that we see people on their worst days, and that's not the end of their story. Sometimes families come back and they can rejoice with us. One of the great things in pediatrics is the diagnostic uncertainty, or rather prognostic uncertainty. I mean, kids get better. They, their little bodies heal so quickly. They respond so well. Like, this is the vast majority of what we see are amazing things. And I will tell people, as a chaplain who, again, I was not ever prepared at any point in my life to work in a hospital. I mean, I did CPE to do chaplaincy, but I will tell my high school students, please pay attention to biology. You will be amazed when you are 20 years down the road thinking you would never work in a hospital, saying, I do not understand bodies. I don't understand how things work. I think it's a miracle that people understand these things. People have the technology. People have the know-how. That's the miracle that I see a lot.
I actually had a nurse who trained me when I was brand new in the pediatric ICU, who helped me learn that kids get better in a very real way, because I was taking care of a small child around 5 years old who was a victim of a car crash, had been thrown from the car and had a traumatic brain injury, and was very, very sick. And I was certain that this patient would definitely die. And I cared for them for probably a couple of weeks in a row, and then they weren't in the unit anymore. And, I don't know, I guess I didn't think anything of it. But this more senior nurse, I remember, called my cell phone. We were at work, and she called my cell phone. She said, come downstairs, come down to the cafeteria. And there was this little boy sitting in a red wagon, like ordering French fries, completely fine. And that was a really good reminder, or a good lesson for me very early in my career, because I was still being trained by the bedside nurses, that, like Stephanie mentioned, 98% of these children get better. Now, another experience I had, though, during those first few months as a new nurse in the pediatric ICU was there was this little boy who was born, and his name is Forrest. And he was born with and developed an infection. And the infection was very serious, and it made him very, very sick. And he needed to be on a heart-lung bypass machine. And then he developed more problems and had bleeding in his brain and had to come off of that heart-lung bypass machine. And he only lived 55 days. And so he's unfortunately part of that 2% that does die. And I'm going to stop here actually and just and say one thing, because I love to remind people this, that when they say, well, how do you work in pediatrics? Children do die. Mm-hmm. They do. And so, it's on us as Orthodox Christians to still allow families to grieve that, communities to grieve that, and not ignore it, which I think is a very easy thing to do in our Western culture. That's what our Western culture wants us to do, is to ignore it. So anyway, so this little boy, Forrest, he died. And what his family has created, they found hope. Like Elizabeth said, we don't know sometimes what happens afterwards, but this family has created an amazing support for other families of children who are critically or chronically ill. And they started with just making a small basket of, comfort items for families who are in an ICU setting. And they started with just our hospital. And now they've expanded. They're in 5 different hospitals. They cross over the entire state of Tennessee. And they do so many different things. They have mentors. They have mothers who will go and mentor other mothers who have sick children or who have children who have died. They provide Christian-based counseling for families. They have grants that help families with different needs. And what's so amazing, and I feel so incredibly honored, and I feel you probably are this way too, but that now that, I took care of Forrest when he was a newborn and so sick, and now here I am as a nurse practitioner, and I get to write the letter for the grant form, for our families to receive aid. And to me, that is just like this beautiful, circle, where it's, that's hope realized, and the fact that I'm a very small piece of it is, just such an honor.
And to this point, this was a young couple. The father was a orthopedic resident. The mother was working in her church. They were very young. And when we told her that there was nothing left to do, she wailed. And they could have walked away, but they chose not to. So if you hear the Forrest Spence Foundation, that is who these people are. And it is such a commitment on their part to keep their son's memory alive. They have 2 other boys and a little girl.
So I actually have this print in my office. It's now, I don't think he's gone through the official canonization process, but has been recognized as a saint. Elder, now Saint Sophronia of Essex, has this little quote that I love: "Stand at the abyss of despair, and when you see that you cannot bear it anymore, draw back a little and have a cup of tea." Again, we are called to engage and to live in community. I have a job where I'm on call. I might take a pager. I might be in one of the ICUs. I might be in the emergency department. I might just be walking around having a conversation with a nurse. I give so much of myself, and through my prayer life and through my work with friends and colleagues, I know that I have the strength to do it. But I also have the awareness of there are times that I just need to stop. I can sit in my office for a minute. I can read. I need to give back to myself. And so there's sort of that balance of taking care of ourselves. And then, of course, I love this quote by St. John Chrysostom. The quote himself, "Glory to God for all things," is beautiful. But these were the last words of his life. As we know, St. John Chrysostom, very mighty saint of our church, but his life was not easy. His example, he died in exile. On an island in exile, and yet he said, "Glory to God for all things." So I remind myself, even in difficult times, number one, it's okay to take a little break, have a little snack. Yeah, sometimes call my friends for a cup of coffee, but also glory to God for all things, because sometimes things might not make sense in the moment. They might make sense. Something might make sense later, or if not, I might say, "God, I know your hand is in this, and bless it." So sort of in the vein of self-care, we made some kuluraikia in honor of our dear St. Theodore with the sesame seeds. So please help yourself. And we have a few minutes if anyone has any questions or feedback. Just pass around, yeah.
We do have 3 minutes for questions.
And we also know, this is going to be an ongoing conversation. The workshop will end, we still can be people that talk, living in community.
Take more than one, they're little. I know. 5, 10.
I know.
Delicious.
Could we introduce
the rest of the
That'd be great.
Thank you. My name's Cassie. I work in an adult critical care setting in Pittsburgh. Thank you guys for your talk, and I'm just reminded about the family care that we provide, and even when I have adults, sometimes they are still children of somebody, or they're parents of somebody, and the children become the parents, and so it's just really beautiful that we're able to do that. Thank you.
Hi, I'm Heidi Isaac. I came to this talk because currently I'm doing a master's in religion, but I hope to go to med school, and ultimately I'd like to work in pediatrics. So
I look forward to seeing you.
I'm Helena Warren. I'm a family physician. I'm on the executive board at O'Camper. So as a family doc, of course, we're cradle to grave, almost literally. And the topic interested me, and I'm really struck by this concept of my work as my prayer, because I've been thinking about that and feeling that a lot lately. So thank you for kind of reinforcing that.
My name is Sue. I'm a nurse practitioner in Colorado. I'm getting to the end of my career, and I have families that I have seen for 4 generations. And so I've been really blessed to know these people in depth, and you can see how they've taught their children over and over again through the generations, and how those things really are so important to take the time to listen. So that's the one thing I've learned in all of my years is listen more and talk less.
I'm Stacy. I'm, like I said, an adult nurse practitioner on the inpatient medicine team. And I came, this is the only second time I've come to one of these, but I just very much felt the need to be refreshed a little bit. And I think, we're all very, we carry a lot of bags, and we carry very, very heavy bags. And sometimes, we need things like this to come together and kind of refresh ourselves so we can be the best for the people that we care for.
Hello, I'm Connie. I am a retired clinical laboratory scientist, and my dear friends and daughter told me about this subject and conference, and I just couldn't wait to come this year.
Well, and I guess I'll just finish it up by just saying thank you all for coming. And thank you to Elizabeth and Stephanie and Leah for giving us wonderful nourishment, spiritual nourishment, and just every blessing in your continued work. Glory to God for all things.